Hello, everyone. This is Roderick Chua again. For this week's podcast, we are going to talk about advocacy. So, what is advocacy? Advocacy is the pursuit of influencing outcomes, including public policy and resource allocation decisions within political, economic, and social systems and institutions that directly affect people's current lives. And you may ask, why must PTs deal with advocacy? There are a few reasons. The cost of healthcare continues to be a significant health and public issue for the United States. Healthcare spending grew 6.1% in 2007, costing the average person $7,421, accounting for 16.2% of our GDP. Cost and utilization of physical therapy have gone up 4.4% from 2000 to 2002, with expenses averaging $3.4 billion. Healthcare policies have focused on containing costs and expenses, impacting quality, availability, access, and cost to care such as physical therapy. Advocacy aims to balance that with professional perspectives and beliefs. PT's obligation, as dictated by APTA's Code of Ethics, Principle 3 states that a physical therapist shall comply with laws and regulations governing physical therapy and shall strive to effect changes that benefit patients or clients. With the increased aging population, there is an increased number of older people with disabilities and poorer quality of life for those with neurological conditions such as Parkinson's disease, multiple sclerosis, and CVA. PT advocates a model of care for disease or disability management that supports ongoing care to prevent further loss of function and promote fitness in order to promote and prolong independence for those with disabilities, especially those living in poverty who have limited or no medical insurance. Advocacy is part of the PT's professional responsibility to further the profession's ability to serve patients and help them reach their full potential. There are six steps to the advocacy framework. The first step is to identify the problem or develop an idea. It defines that advocacy efforts will seek to correct through policy change. The second step is to compile the necessary research data and background on the issue. This process involves collecting data, conducting research to begin to build a case for change. The third step is used to establish short, intermediate, and long-term goals. This is critical for identifying key advocacy champions and constituencies. The fourth step involves establishing and implementing an action plan. This articulates what needs to be done in order to present the case for change. The fifth step involves implementing coalition efforts to build momentum, to establish consistency in the plan, and to show broad public support. The final step is the assessment and evaluation process. It is essential in a process that is cyclical. So my questions are, number one, reflect on a time when you had to advocate for a patient to continue physical therapy when insurance have refused further visits or payment. What steps did you take and how? Question number two, in your opinion, should insurance cover maintenance therapy? Why or why not? And these are the references. And thank you for watching my podcast.